All right, welcome everyone to our presentation on what's the right amount. We're going to be discussing the nuances of possession limits in Canada, in British Columbia, going over to the States. A conversation today between two advocates on this issue, seeing what Erica found in her research and how we can help each other across those state and country boundaries. So I'll introduce myself quickly. My name is Rob Hofmann. I'm the Policy and Advocacy Director at Students for Sensible Drug Policy. He, him, glad to see everyone here. I will introduce Erica really quickly. Erica McAdam, MPP, is a research assistant at the BC Centre on Substance Use in Vancouver, Canada, and a recent graduate from the Master of Public Policy program at Simon Fraser University. Erica's thesis research, seen here, conducted in evidence-based multi-criteria policy analysis of different decriminalization threshold models for British Columbia, a territory in Canada. Erica's thesis research has won several awards, including the Philip Owen Award for Excellence in Policy Research. So Erica, feel free to add anything there. Otherwise, go ahead with your presentation, and then we can move it over to any questions and a Q&A as needed.
Thank you. Yeah, thank you so much for having me today. So as you mentioned, I'll give a brief 20-minute overview of the thesis research that I conducted recently, which was looking at different approaches to defining personal possession within decriminalization models. And I'm happy to circulate my slides and a copy of the final report if there's interest after. So this research was conducted on the traditional and stolen lands of the Coast Salish people, so the Musqueam, Squamish, and Tsleil-Waututh nations. I'd like to acknowledge that I'm an unwelcomed guest, a white settler who's grateful to be able to live and work on these traditional territories. It's also important to acknowledge and honor the strength of these people and all Indigenous people across so-called Canada as they live through historic and ongoing systematic racism. And the topic that is the focus of this research, drug criminalization, is one that has disproportionately negatively harmed Indigenous peoples and communities and is rooted in colonialism, racism, and classism. So this is a brief outline of what I will be discussing today. So I'll start off by kind of situating the situation in Canada with respect to decriminalization. Then I'll talk about my methodology that guided the study, give a brief overview of my research findings, and then I'll discuss the policy options I analyzed and go through the results of this analysis. I'll end with highlighting the recommendations that I made in my final report. So the policy problem that guided the study is that the criminalization of possession of drugs for personal use creates preventable harms to both individuals and society in BC. And to be clear, this is a problem that affects many jurisdictions around the world, as you all know, including the United States. But my research focused on BC, but these findings are applicable to other settings, and the framework used can be used by other policy researchers as well. So I know most people on this call are well aware of the harms of criminalization, so I'm not going to spend much time reviewing the rationale for decriminalization. But I will give a bit of brief context into the Canadian situation for those that maybe don't have as up-to-date knowledge on it, because so much has changed in such a short period of time. So the City of Vancouver and the Province of BC both submitted applications to Health Canada under Section 56(1) of the Controlled Drug Substances Act for the decriminalization of personal possession of illicit substances. And so my analysis was conducted before decriminalization was approved in the Canadian setting. So I evaluate each of those proposed models that the city and the province submitted to Health Canada. And both of these models have a higher threshold than the one that was actually approved. So the exemption was approved just this past May, and it's time limited and starts at the end of January 2023, and it runs for about 3 years until 2026. So the threshold that was approved is a cumulative amount of 2.5 grams. And so it covers opioids, cocaine, crack cocaine, and methamphetamines and MDMA. So you can have any combination of those substances up to 2.5 grams in order for it to be considered personal possession and in order for you to be protected by decriminalization. And then another limitation of this is that it only includes adults 18 and older, so it excludes youth who use substances. It also excludes diverted pharmaceuticals and psychedelics. These both weren't included in the decriminalization. So there's typically 3 key components to decriminalization models. So the first is whether police can seize substances of somebody found in personal possession. The second is whether there's an administrative sanction or penalty when somebody is found in personal possession. And the last component is how do you define what constitutes personal possession? And my research didn't analyze the first 2 components. So each of the models I look at do not allow for drug seizures for personal possession, and there's no administrative sanction. And this is aligned with the model that was approved for BC in the Canadian context. But it's important to note that this is very different than jurisdictions such as Portugal and other places in the world. So these are very important components to have in place. My research really shows that police seizures, administrative sanctions perpetuate many of the same harms that we see that come from criminalization. I'm happy to go into more detail about these components in the Q&A if there's more questions. So my research really focused on the last component, which is defining personal possession. And there's really a lack of evidence and evaluation of different models, and my research tried to help fill some of that gap. So there's 4 research questions that guided my study. The first is, what are the feasible and realistic objectives of decriminalization of personal possession? So in thinking about defining personal possession, it was apparent that the first step was to get clear about the realistic and feasible objectives. And this became the foundation for evaluating the different models that I look at. The second is, what model of defining personal possession best advances the key objectives of decriminalization? The third are, what are the key trade-offs between different models of defining personal possession? And this research question really focuses on identifying the key evaluation criteria and conducting a thorough analysis of the different models that I look at in this analysis to really highlight the strengths and limitations of each of them. And the fourth research question is, what are the impacts on different definitions of personal possession have on equity deserving groups? And my research took an intersectional lens within my analysis and to consider equity deserving groups and the different impacts that different threshold options would have on these groups. So data from a literature review, 16 in-depth qualitative interviews with experts, and police seizure data and consumption data from longitudinal cohorts of people who use drugs in Vancouver was used to inform this research. And then I conducted a multi-criterion policy analysis. And I'll just give a brief explanation of my process and what that looked like, because there are different approaches that can be used for policy analysis. And I want to just make sure that I'm clear about how I did it. So the research and data was used to identify the key objectives of Decrim, and then to identify the different decriminalization models that I was going to evaluate. And then I used that data to select a consistent range of criteria and measures, which were then used to evaluate each of the different decriminalization models that I looked at. And by using consistent criteria and measures, you can highlight the trade-offs between these different models. And it's also important, within a multi-criterion analysis, that you have criteria that kind of conflict with one another, so you can really bring forward the strengths and weaknesses of each of them. So I interviewed a range of different people for this research. So 38% represented people with lived and living experience of substance use, 19% represented law enforcement, 19% represented government, and 63% represented non-for-profits. So interviewees were asked what they felt the key objectives of decriminalization were. And they really felt that these, the reasonable and feasible objectives were to reduce contact with the criminal justice system for people who use drugs. And an aspect of this was to reduce police drug seizures for personal possession and related harms. And the last component is to reduce stigma against people who use drugs. And each of these 3 key objectives are incorporated into the evaluation criteria that I used to evaluate each of the different models. Interviewees felt that decriminalization was not about responding to or stopping overdoses. It was really about taking away some of the harms of criminalization. So it's important to recognize that, especially within the Canadian context, that we're still operating in a state of prohibition. So trafficking, for example, will still be illegal. So decriminalization of personal possession is just one piece of the puzzle. It's not an answer to everything. So it's not expected to affect the toxic drug supply. So it's not going to substantially reduce overdose deaths. And interviewees also felt that decriminalization was not about increasing contact with healthcare systems. That doesn't need to be the key foremost objective of decriminalization in order for it to be successful. So now I'll briefly touch on some of the interview themes that emerged from my interviews with experts and stakeholders. So interviewees highlighted that there's a number of equity issues that need to be considered when we look at models that set threshold quantities to define personal possession. So interviewees discussed how different equity deserving groups, including people with mobility issues, those experiencing homelessness, Black, Indigenous, and people of color, will all be disproportionately affected by models that use threshold quantities that are low. And these concerns related to equity are incorporated into one of the evaluation criteria that I use surrounding equity and fairness. So an example of an equity concern highlighted by interviewees was that they discussed for how some people who use drugs that are experiencing homelessness will be disproportionately affected by threshold models that have low quantities, because people experiencing homelessness don't have the ability to store their belongings in a safe place like I would, like in my home. They have to keep everything on their person. So as stated by one interviewee, they said, for people who are unhoused, they're necessarily carrying all their belongings on them, and they don't have the luxury of keeping their stash at home, where it's unlikely to be searched and seized by police. It's important to note here, as a result of the ongoing colonization of Indigenous people and land theft within Canada, Indigenous people are overrepresented in the population of urban people experiencing homelessness. Indigenous people are consistently targeted and criminalized by law enforcement here. And therefore, folks who are Indigenous and experiencing homelessness that meet at these intersections are more likely to be disproportionately negatively experience impacts of a model, especially those that have low threshold quantities. So this really highlights how important it is to keep people experiencing homelessness incorporated into the evaluation criteria. So another interview theme that came forward was discussed by interviewees representing law enforcement. And it centered around what they would characterize as unintended consequences. So they felt that models with higher thresholds may incentivize gang activity. They may result in an increase in the incidence of impaired driving, and that decriminalization could result in an increase in incidence of public consumption. But not all law enforcement interviewees that I spoke to felt this way, and some actually felt quite differently. As stated by one interviewee, they said, "You'll hear this from police as well. You'll hear that organized crime, and somehow with decriminalization, it's going to be their opportunity to extend their reach and increase their income and all these sorts of things." And police had the same argument at the time, that if you legalize cannabis, organized crime is just going to go wild. They're going to love it. Well, in actual fact, the data shows that that hasn't happened. And, you know, organized crime hasn't taken off and they haven't opened shops all over the place. So that's actually not come to bear. So while some of these concerns expressed by law enforcement in interviews could be characterized as public safety issues, the credibility of these consequences was assessed to be limited in my analysis. So for example, crime rates in Portugal didn't increase following decriminalization. Incidents of impaired driving in Canada did not increase following cannabis legalization. They continue to dominantly be alcohol-based. And there's other ways to manage public consumption. Research has shown that public consumption is as a result of numerous factors, including a lack of safe spaces to consume substances and lack of housing. So therefore, public safety as articulated by law enforcement within the interviewees was not a criteria in the analysis, but instead was used to assess the basis of their stakeholder acceptance of different models. So now I'll discuss the different models of defining personal possession that I looked at in my analysis. So the first policy option here is a model that does not use threshold quantities. So it instead defines personal possession as the absence of evidence of trafficking. So this model would result in personal possession no longer being a charge available for police to pursue under the Controlled Drug Substances Act. Policy option 2 are the City of Vancouver's thresholds that were submitted to the federal government in their application for Decrim. They use a different threshold amount for different substances. Policy option 3 was the province of BC's threshold submitted to the federal government, and they used a cumulative threshold of 4.5 grams. So that just means that you can have any combination of opioids, cocaine, crack cocaine, and methamphetamines. And so long as it's under 4.5 grams, it would be considered personal possession. And then the last option is a cumulative threshold of 15 grams. And this was developed based on data from the literature review and qualitative interviews. And this means, again, that somebody can carry any combination of substances up to 15 grams in order for it to be considered personal possession. So I used 8 different evaluation criteria to evaluate each of these 4 policy options, and they encompass the key objectives of decriminalization that really emerged from the interviews. So that first objective was to reduce contact with the criminal justice system for people who use drugs, and I used 2 separate evaluation criteria to look at this one. So the first is to reduce negative and harmful interactions with police. And the second criteria is to reduce police drug seizures for personal possession. And interview participants were asked what percentage of seizures ideally should be reduced in decriminalization using seizure data that we currently have from the Vancouver Police Department. And interviewees felt that the target should be at least a reduction of 75% using that data. Now looking to equity and fairness, the third criteria is inclusion of those with the most serious substance use disorder. And again, interview participants were asked what they thought an appropriate level of coverage would be for thresholds if we were looking at drug consumption data. So the options that were put to them was to use the average of all consumption reported in the sample, to use the upper quartile, so the average of the top 25%, or the maximum, so the person who reports the maximum use within the sample. And then they were also asked how many days supply should the threshold ideally cover if we're going to project that amount. So interviewees really made a case for using the highest range, so the person that reports the maximum consumption in the sample, and to project that for a 3-day supply. And the rationale for this was multiple, including considerations for people that live in rural and remote communities that may have to buy substances in bulk to sustain a supply for themselves. And here I used consumption data from longitudinal cohorts of people who use drugs. And I use that to project the coverage that each model would provide. So the next criteria is impact on equity deserving groups, which include people experiencing homelessness and those with mobility issues. The fifth criteria is focused on ease of implementation and communication and is a function of how simple and clear the model is. So how easy is it for the everyday person to understand, and how easy is it for the police? And then the last three criteria really focus on stakeholder acceptance, so by people who use drugs, law enforcement, and the public. And I'll go into depth on how each of the models perform with respect to the first three evaluation criteria. And then I'll do a brief overview of the other criteria, and I'm happy to chat and go into more detail later on if there's questions in the Q&A. So for the first criteria, to reduce negative and harmful interactions with police is measured by the level of expected reductions of interactions. So models are rated either good, moderate, or poor. So models that have higher threshold quantities are expected to substantially reduce interactions with police. Whereas on the other hand, models that are rated poor are not expected to substantially reduce police interactions. So this is a matrix of how each of the models perform with respect to this first evaluation criteria, which is to reduce negative interactions with police. So the policy option 1, the no threshold model, and the cumulative 15-gram model perform the best here. Whereas the City of Vancouver's and the province of BC's models are not expected to substantially reduce negative and harmful interactions with police, and therefore they receive poor ratings. So the next criteria is looking at reducing police drug seizures for personal possession. And the measure for this criteria was how well the model meets the threshold quantities that would reduce 75% of drug seizures using the VPD drug seizure data. So models are scored either good, moderate, or poor. Models that are good, they meet these projected amounts using the data, whereas models that perform poorly do not meet the 75% cutoff. So this slide details the evaluation of the City of Vancouver's model just because it's broken down by substance type. So using the VPD seizure data, the amounts that would reduce 75% are projected here. So for opioids, the threshold would have to be 7.37 grams. And the City of Vancouver's threshold of 2 grams for opioids doesn't meet that. For cocaine, crack cocaine, it would have to be 5.4. And again, the City of Vancouver's thresholds don't meet that as well. And then for methamphetamines, it would have to be at least 4 grams to reduce 75% of seizures. And the City of Vancouver's 1.5 gram for methamphetamines doesn't meet that. So as an aggregate rating, it gets a rating of poor because it doesn't meet any of the threshold projections using this seizure data. So looking at the cumulative threshold models, using that data again, the amount that tells us that would reduce 75% of drug seizures is 9.161 grams. So the no threshold model, because it doesn't use thresholds and it removes personal possession as a charge for police able to pursue, it's expected that it would reduce 100% of seizures for personal possession. So it receives a rating of good. Whereas the province of BC's model, the 4.5 gram is significantly less than the 9.61, so it receives a rating of poor. And the global 15 gram model is much higher than the 9.61, so it also receives a rating of good. And this is just how all the models perform together. And looking at the third criteria, which is inclusion of those with the most serious substance use disorder. And this is where I use the longitudinal cohort data from the BC Centre on Substance Use. So as mentioned previously, I use the max reported consumption levels in the sample, and I project those quantities for what a person would use for a 3-day supply. So the models are scored either good, moderate, or poor, or a combination of these ratings. So models are rated in comparison to one another based on how they meet the projected amounts using that consumption data. So the amounts using the data are here in the gray column. So the threshold would have to be 13 grams for opioids in order to cover the person who reports the max in the sample for a 3-day supply. It would need to be 14 grams for powder cocaine and 22.5 for raw cocaine and 19 grams for methamphetamine. So the option 1, the no threshold model, allows for the inclusion of the consumption patterns of all people who use drugs, and therefore it receives a rating of good. Whereas the City of Vancouver's thresholds are significantly lower than the amounts that would protect the people with the max consumption, so it receives a rating of poor. The BC model also receives a rating of poor. And the global 15 gram model receives a rating of good/moderate. It performs much better in comparison to the other models, but not as well as the no threshold model, so that's why it receives the good/moderate rating. And then this is just how each of the models perform against one another. And so now looking at the fourth criteria, which is equity deserving groups. So models with higher threshold quantities are expected to have the smallest disproportionate impact on these groups. So as you can see here, the global 15-gram model performs the best. The no threshold model receives a rating of moderate. So a potential unintended consequence discussed in interviews was that there may be an increase in charges for possession for the purposes of trafficking, or an inability for those to plead down from more serious charges to possession charges. And we all know that equity deserving groups are over-targeted by police, so it's expected that these groups would bear the brunt of these risks if they were to come to light. And so the fifth criteria is looking at simplicity. So that's ease of implementation and communication, which is really just a function of how simple and clear the model is. And I based this measure on whether police are required to weigh substances and if they have to decipher between substances. So the no threshold model doesn't require police to do either of those things, so it receives a good rating. And my research really highlighted that using different threshold quantities for different drugs is very complex. And that's for multiple reasons, including that the supply is just not clear cut. In Canada, it's quite toxic, so we really don't know what people are using. And that's a really important key limitation of the City of Vancouver's model. And now turning to stakeholder acceptance, it's expected that people who use drugs would be the most supportive of the no threshold model and the 15-gram model. Law enforcement are supportive of the City of Vancouver's thresholds and very opposed to the no threshold model and the cumulative 15-gram model. And for the public, the no threshold model has the highest risk of public backlash, whereas the City of Vancouver's and the province of BC's models have the lowest risk of public backlash. And so this slide details the final matrix of how each of these models perform with respect to the 8 evaluation criteria. So the models that perform the best are policy option 1, the no threshold model, and policy option 4, the cumulative 15-gram model. And the strengths of these models is that they're both expected to substantially reduce negative and harmful interactions with police. They're both expected to reduce 75% of police drug seizures. They both encompass high levels of protection for those with the most serious substance use disorder. And they both have high levels of support from people who use drugs as a stakeholder group. However, they do both negatively score in terms of their support from law enforcement as a stakeholder group. But it is expected that the no threshold model will receive substantial opposition from law enforcement and the public. So based on the findings of this policy analysis, the approach to defining personal possession that was recommended in my report is the option 4, so the cumulative threshold of 15 grams. It scores highly on the objective of reducing criminal justice system contact. There's less of a negative impact on equity deserving groups than the no threshold model, and it has a lower risk of public backlash. In terms of trade-offs, the global 15-gram model is expected to be very opposed to by law enforcement. So in conclusion, the lived experiences and the voices of people who use drugs need to be centered and meaningfully included in the development of Decrim models. The perspectives of people who use drugs were centered in this analysis. And my research really highlights that definitions of personal possession significantly impact the extent to which the objectives of decriminalization are achieved. And this analysis really shows how the proposed models by the City of Vancouver and the province of BC are not expected to meet minimum expectations for the key policy objectives, which just highlights how the approved model of 2.5 grams will be wholly inadequate. And this analysis recommends a cumulative threshold of 15 grams as an approach for decriminalization for the province in order to maximize effectiveness on the key objectives of decriminalization while balancing trade-offs. I'd like to take a moment just quickly to thank the people that participated in my study and acknowledge the catastrophic ongoing overdose crisis, which has really shown the gravity of this policy issue right now. And for some stakeholders, the recommendation of 15 grams may seem quite high, but decriminalization is really conservative given the decades of harm and the substantial loss of life we've seen during the overdose crisis. It's important to keep in mind that a true response to this crisis will require many more actions in addition, like a safe supply and listening to and uplifting the voices and perspectives of people who use drugs. Thank you all so much for listening. I really appreciate it.
Thank you so much, Erica. As a reminder, please add your questions for Q&A. I have a few here in terms of discussion questions, but definitely want to hear everyone's thoughts and questions for Erica to share. I have a few questions here based on the presentation. My first is around police drug seizures and administrative sanctions in countries like Portugal that have different types of drug decriminalization. You said that the British Columbia model would not have that, and also you would recommend against the adoption of that. Could you say a bit more about what types of sanctions and seizures countries like Portugal or maybe other localities or states have, what administrative sanctions and seizures they have and why those are harmful or detrimental to a drug decrim scheme?
Yeah, of course. So In my research, it became very clear that using seizures and administrative sanctions is actually a key component of a lot of different jurisdictions models. And I think within that, the use of that, you're still saying that there's something wrong with drug use. And I think the idea of decriminalization is that we're saying it's not a criminal issue and we're not going to criminalize people for using substances. But when you attach fines or you seize people's substances, you're still saying there's something wrong with this. And yeah, my research really highlighted that you just perpetuate many of the exact same harms that you see within prohibition when you still seize people's substances and you still give them fines or sanctions. So for example, when you see somebody's substances, that obviously doesn't stop substance use. All that results in is that somebody's going to have to go out and hustle and do what they need to do to get their substances. And that can also result in increased overdose risk because somebody may be using faster in order to avoid withdrawal, or they may be getting substances from an untrusted dealer because they're kind of in a pinch and they need to find somebody right now. So lots of harms that come from seizures. And then in terms of administrative sanctions and penalties, same sort of harms we see with criminalization. So like with fines and stuff, if you're giving fines to somebody who's street entrenched or can't afford housing or is experiencing homelessness, that's going to do nothing to support them in their life. If anything, it's just going to be more and more harmful. And when those fines build up, you contribute into that cycle of poverty that a lot of people who use substances are experiencing. And in terms of like the different sanctions that we see, like Portugal will have, they have this like mandatory panel committee that people have to show up in front of. And, you know, that requires people taking time off work if they have a job, having to get childcare if they have kids. Like there's lots of negative impacts of that. And then people will be issued fines. And so the same sort of harms we see with fines as we see with the current system. Yeah, let me know if that answers your question or if you want any more detail.
I think so. I brought up another thing, and I'll push it to the Q&A in a minute. Do any of those sanctions include any like mandatory treatment models, anything like that? Okay.
Yeah, so in Portugal, they use something like this, kind of like playing with words, but they call it like a dissuasion committee. And it's essentially a form of mandatory treatment, which we know is totally ineffective. It doesn't work for most populations of people who use drugs and is quite dangerous because it increases overdose risk when people leave treatment. So yeah, good point.
Okay, I'll include one more question and push it over to Q&A for a bit. You mentioned in the presentation that drug decriminalization models reduce stigma against people who use drugs. Could you just say a little bit more on that, on how these drug decriminalization models reduce stigma and support people who use drugs?
Yeah, totally. So I think a long-term objective of decriminalization is to reduce stigma. So what we see that stems from criminalization is that substance use in general is stigmatized. So that may look like people using substances in the shadows and maybe alone in their home, which increases overdose deaths. Or it looks like people not seeking help from their family doctor or telling their family members that they're struggling with a substance use issue, which also creates tons of harm. And then as a society, we really stigmatize people who use drugs. And that really flows from the idea that we've said, you know, these medicines and these drugs are not right and they're illegal. So you just don't see the same stigma with alcohol use as you do with like using crystal meth. And that's really because of the environment of criminalization. So ideally with decriminalization, by shifting the narrative around which substances we view as legitimate and illegitimate, the stigma against people who use drugs would be reduced. So that would result in an increase in contact with healthcare systems, hopefully, maybe people seeking out more help before it gets to a point that they feel it's a problem. Not using alone at home, which increases overdose risk. Maybe they're accessing safe injection sites because they're not afraid of being stigmatized by their employer. But all of these things, this reduction in stigma is a very long-term objective. So when we look at cannabis use in Canada, so we've had legalization for a number of years now. And I would say that stigma has pretty substantially reduced, but it still exists. It's still within society. So and we hope that over time, those things will be reduced. And then that's also a function of the model too. So I think what you see with models that use threshold quantities is that you're saying like up to a certain amount, it's okay. And after that, it's still bad. So I think that is a problem that we see with these threshold models is that we're still saying, you know, these substances are bad, and so you could only have this much. So I think the effect on stigma with threshold models is just not going to be as robust as it would be if you had a model that didn't have thresholds. So if it was just a model like we have with alcohol, where you can just go buy as much as you want, I just think the effects would be different long term.
Okay, sounds good. I'm actually going to try to combine a question that I had and Edelic Center had. So looking back here, moving a few screens around. So the British Columbia drug decriminalization would decriminalize possession of 2.5 grams or less of four things, it seems: opioids, cocaine, methamphetamine, and MDMA. The Delic Center was asking why it didn't include psychedelics and other entheogens, and I wanted to know why specifically they chose those four and how that might reduce the efficacy of that decrim model.
Totally. I think it is such a shame that psychedelics were not included, and same with diverted pharmaceuticals. I think there's multiple reasons why not. So decriminalization in the Canadian context has really been positioned as like a solution to the overdose crisis. So when we look at overdose drug deaths at the coroner's reports, the substances that are most frequently found in overdose deaths are opioids and stimulants. So that it was the justification for why Decrim really focused on the 5 key substances. And also decriminalization was really being pushed through in kind of like a policy window. So within the Canadian context, there was an election coming up. We had a peak number of overdose deaths during the pandemic. So there was multiple factors that led to this policy window where there was a chance for decriminalization to be pushed through. And because of that, these policies were put together extremely fast and they were pushed through basically. So I think because they were put together so quickly, so you can see like issues within the Vancouver models, they didn't consult people who use drugs, and they will say it's because of the timing. So I think because these things were happening so quickly and they were trying to meet the political willingness at the time, I think things got left behind. And so that would be my explanation for why those substances were excluded. But yeah, it is a shame that they weren't included as well.
Okay, and thank you for that response. I will go to the first anonymous attendee question here. Could you review again why the 15-gram threshold scored better on impact on equity than no thresholds?
For sure. Yeah, that's a great question. And I think that's something that really came forward in the interview. So basically, within the Canadian context, we have systemic racism within policing, and people felt that when you have a threshold, which is a clear line in the sand, you take away police's ability to police all different types of possession. So what people argued with the no thresholds is that, you know, if you have a threshold of 4.5 grams, maybe the police aren't going to stop people that they know don't deal. But if you have a no threshold, each situation and each time somebody interacts with the police are deciding if it's personal possession or not. So that argument is that you just give a lot of the ability to decipher what constitutes personal possession to police. I think the other end of that argument is that if you define it as the absence of evidence of trafficking, then the police have to prove that somebody is trafficking. So they need to say that they had a scale. And within the Canadian context, the weight of substances that somebody has on them it's a factor, but it's not a deciding factor. But then again, within the Canadian context, there's just a fundamental mistrust of the police. So like, are we expecting that the police are going to actually enforce trafficking if it's trafficking, or are they just going to say that everything they see is trafficking in order to charge more people? So basically with that threshold model, ideally what would happen is if those risks were come to bear, they would be disproportionately felt by equity deserving groups because they're over policed. So it's a negative of the model in general, but it will be especially felt by groups who constantly interact with the police. So within the Canadian context, that's Indigenous folks. Let me know if that makes sense, if that answered the question.
Okay, it looks like that question got answered, or I'm not sure how that worked, but I'll go to anonymous attendee number 2, and we can obviously keep the conversation going if needed. So how actionable or easy is it for people who use drugs to make sure they are below a 15-gram threshold? And does that still pose a substantial burden?
Yeah, that's a great question. I think when you have, so with lower thresholds, I think it has much more of a burden on people who use drugs, because maybe you're buying like 0.2 of a gram or something like that. And then you have to think, if the threshold's only a gram, like how much can I actually have on me, especially if you take different substances. I think that burden is less with a 15-gram model because it's such a high threshold. And it's a question that people who use drugs are asking in the Canadian context, is how are police going to weigh substances? Are they going to keep scales on them? And we don't actually know that yet. So the police are still kind of like formulating how they're actually going to approach decriminalization. But yeah, so I think that is something that would burden people who use drugs. But I think ideally, if it was 15 grams, it would actually provide coverage to most people who use drugs, and most people, based on consumption levels, are under that 15-gram threshold. So, and I think it also incorporates the purchasing of quantities that are common. So like an 8-ball, like 15 grams incorporates that, whereas a lower threshold, like 2.5 grams, wouldn't incorporate it. So it'd make it much more difficult, because somebody would have to go home and kind of like split their substances to make sure that they're under if they're going to leave their house, if that makes sense.
Yeah, I think that was a good answer. I'll go to the next person then. What role would you say this proposed personal possession threshold plays concerning drug testing in the workplace? And this might be different for Canada than the States. I'm not sure where this person is from though, so if you could just give the Canadian context on that.
Yeah, that's a great question. And it's actually something I don't have a ton of information on. So that's something I could definitely look into and get back to you. But my understanding within the Canadian context is that if a workplace requires that people aren't under the influence of substances, so like cannabis, they're allowed to test. So I know, for example, like nuclear power workers within the Canadian context get tested for cannabis use. So I would assume that the same policies would apply in that sense. But we don't have like general widespread workplace drug testing. It has to be a criteria of the position that somebody needs to be sober, essentially. So it will be like heavy machinery mechanics and people like that. It wouldn't be just like general workforce. But yeah, I'm curious. I'm also curious of what's going to happen with that. I'm sure we'll see like a lot of union disputes that come from that. So it'll be interesting to see.
Yes, it seems like you have much better laws over there than we have here. Moving on to the next question. And then I have another question on my end, and I'll leave some time for any folks to add anything else. Do you think the proposal with these small amount thresholds is likely to build political goodwill as an incremental step, or if it is shown to be ineffective, will it risk producing more backlash?
Such a great question. I think, me as being like an advocate and, I'm not like super jaded yet in my career. I'm like, no, we need to like do this right the first time. And it should be 15 grams and we should do this radical step. But I think a lot of drug policy is incrementalism. And I think, a 2.5 gram threshold is clearly not enough. The research shows that it's not enough, but it is somewhere. And I think that is, I have to remind myself of that, because, something is better than nothing. And this is pretty historic that this is even happening. So I do think the 2.5 gram is good in terms of political will. It's one of the higher thresholds in the world. And yeah, and I think there'll be quite robust evaluation of this. So the data will show that there's going to be improvements. I think the danger when it comes to the low threshold is that politically it was being positioned as a solution to the overdose crisis, which is so problematic because decriminalization does nothing to affect the supply, and the supply is toxic, and that's what's killing people. Decriminalization just takes away some of the harms that people experience in their day-to-day lives in terms of interactions with police. So it doesn't even touch the supply. So my concern is that when that rhetoric is kind of mixed together and people are told that decriminalization is going to affect the overdose crisis, in 3 years' time, overdoses are going to continue to increase unless we implement something like a safe supply. So I worry that legitimate critiques of decriminalization will come from people who don't understand that it's not going to affect overdoses. And like, I think of like the opposition parties here in Canada, like Conservatives, just positioning and saying, you said that this was going to affect overdoses, and overdoses have continued to increase over 3 years, so it's not working. But I think it is important. And I think researchers are doing a great job of this, of separating those two things. You know, decriminalization is a piece, but it's not the whole story. And yeah, so I hope that through evidence and data and through evaluation, we can show that it is a really positive thing. But yeah, I think there's always going to be room for critique, which is too bad.
Okay, this next question is for myself. So for the British Columbia drug decriminalization, and I believe most other decriminalizations as well, it's only for adults 18 and older. So I want to just check in with that regarding what role young people can play in terms of passages of different drug decriminalization measures, and how having a decriminalization for only adults 18 and older might continue negative impacts of criminalization for youth.
Totally. I think that is, I mean, that's such a great question. And I think that is like a glaring omission in the BC decriminalization, that youth were excluded. Because the fact of the matter is that youth use substances. By not including them in decriminalization, we're denying the reality that kids use drugs. And, you know, politically, touching youth substance use is so contentious in the Canadian context. Like, as soon as you say that, you have like groups of moms and parents and like school boards and stuff just going wild. So they've positioned it to be a totally different issue, even though it really is the same thing. And within the BC context, youth experience all the same harms that adults experience. And if anything, to some degree worse, because in BC, there's been legislation that has been tabled in multiple occasions that actually is asking for mandatory treatment for youth if they overdose. And we know that mandatory treatment doesn't work. It is really ineffective and it's really harmful. So youth are just as equally harmed by criminalization, and unfortunately aren't going to feel the benefits of this policy. And I think it just goes to show how arbitrary it is. Like, if a kid has substances and it's their 17th birthday, they're going to be charged as they would usually. But if the kid's 18, then they're covered by decriminalization. Like, it's so arbitrary. It's a very arbitrary line in the sand. And then in terms of like advocating for decrim, within Vancouver, there's lots of youth subgroups of kids who use drugs, basically. I should say youth that use drugs, that are advocating for this and have been quite loud about the exclusion of youth within decriminalization. And I think it all comes down to advocacy again. I think, unfortunately, it seems like there's a lack of political will, and it seems like something that might happen after decriminalization is evaluated for 3 years. But it is a shame for sure. But that's a great question.
Thank you. Looks like we have a few more questions. First is Jacob Ross, who's actually working with us regarding a San Diego resolution campaign that we're doing to decriminalize drug possession and a few other things there. Very excited to have him here. What role does harm reduction play in concert with decrim?
That's great. I feel like I would categorize decrim as a type of harm reduction, because the focus really is to reduce harms. But yeah, I think when you think of harm reduction in terms of like safe injection sites or needle exchanges, in the research has shown that police presence and criminalization actually inhibits people's accesses to those sites because they're afraid of being criminalized. So if you go there with your drugs and there's police that are just sitting outside the safe injection site, like, that makes people feel unsafe, and it makes them feel like they can't actually access that resource. So I would think within decriminalization, when we say, you're no longer going to be charged with the substances that you have on you, so long as they're personal possession, I would think that access to harm reduction services would increase. And this is something that the province is looking at evaluating within decriminalization. And I think it'll be really interesting to see the effect that it does have on accessing those services. But yeah, I would say decriminalization and harm reduction are I would say decriminalization is a form of harm reduction for sure.
Excellent. All right. Looks like we have one more so far. Again, definitely have time, so feel free to add any as desired. Does Canada have a drug testing program similar to Spain, where they can analyze what the drugs are and how much of them are in a delivery system, aka a capsule, tablet, etc.? If not, would this be the next big step for Canada before attaining legalized storefronts providing clean drugs?
So drug testing in terms of like testing the substance of like what's actually in it, I assume?
It seems like,
yeah. Okay. So we have like government funded drug testing in terms of like for research purposes, basically to see like what's in the street supply. It's not really widespread. It's also quite expensive, the technology that they use. Yeah, and then, you know, I think there's a lot of barriers to actually having like a full legalization system. I'm sure that's one of the barriers, but there's just so many in terms of like political will, that, yeah, I would hope that it would happen in my lifetime, but I feel like there's lots of barriers, and I'm sure the testing and production is a big part of that as well. Yeah, that's a great question.
Very good. It looks like we have another question here. A lot of questions for Erica today, which is good. I think the law enforcement perspective is interesting to hear, if expected. Does law enforcement think that decrim proposals are actually likely to reduce their ability to target larger drug dealers or cartels? And second, does their idea that decrim will increase demand and therefore cartel activity hold any weight?
Yeah, great question. The law enforcement perspective is super interesting, and especially in the Canadian context, because it's kind of a lot of like, well, this is going to happen. Well, this is going to happen, but then there's just like no proof that any of these things have happened. So it was in the analysis, I was kind of like, I can't like put that in the framework because it's not legitimate. Like there's no empirical data to back this up. Yeah, so it is really interesting. So does law enforcement think that decrim proposals actually reduce their ability to target larger dealers and cartels? So what's interesting within the Canadian context is we actually have support for decrim from the police. So the police want to decrim. Their issue is the threshold so like the Canadian Association of Chiefs of Police have asked for 1 gram, which is the same as Portugal and Oregon. But I think one of the positives with decrim, as they see it, is that it actually diverts resources so they can focus on the bigger dealers and the cartels. That's what they would say is the benefit, is that they can actually like spend more time looking at these and enforcing more serious level offenses. So they would agree with decriminalization being able to do that in like a positive way from their perspective. And then the second component of your question, decrim will increase demand and therefore cartel hold anyway. Yeah. Yeah, so that is a common argument from police in other jurisdictions, is basically like if you decriminalize, you're sending a message that it's okay to use substances, so more people will use substances, and therefore like increase the reach that cartels could have on society, essentially. If we look to other jurisdictions like Portugal, who have decriminalized all their substances, we can see that use doesn't actually increase. So decriminalization doesn't actually affect the number of people using substances. And that's pretty interesting. And I think my favorite thing to say to people when they bring this up, and I'll just be like, well, are you going to start using like crack if it's decriminalized? You know, like, no, you're not going to, unless you already do. So like, I think that argument just also doesn't really have any empirical baseline for it, because we really just don't see substance use increase following decriminalization. The people who have used substances before it was legal or illegal will continue to use substances. Yeah, so I think that demand increasing following decriminalization just doesn't have a ton of weight.
All right, sounds good. I'll give it a little bit, see if there's any more questions, but yeah, I think for now, I just want to see if there's any final thoughts you had or comments in terms of this, like drug decriminalization in Canada, drug decrim in general. Obviously, we have a lot of people from different cities, states, counties, territories, countries at the moment. So right now, part of this conversation is just us figuring out both like what your research was and also like how to figure it out for our own individual jurisdictions, territories, etc. So yeah, I'll just throw it back to you. And then if anyone else has any questions, we can answer it. Otherwise, we are free to take the afternoon off.
Yeah. Yeah, totally. I think it's a really amazing component of decriminalization happening within BC is that it sets a precedent for North America. So the precedent that was previously set for us was looking at Portugal and jurisdictions in Europe, and the thresholds used, like we've mentioned, are just not adequate, especially within the context of an overdose crisis where the supply is so toxic that people's tolerances are just unmatched. Like the people who use substances here are using a substantial amount of drugs because of the toxic drug supply. So taking a threshold from another area of the world just makes no sense. So I think in a positive light, Canada having this 2.5 threshold sets a standard, at least sets a precedent that people can point to within the states and say, you know what, this is what BC chose, so we should at least start there. It shouldn't be less than that. And there was a lot of research that went into supporting decriminalization within the Canadian context, and it's unfortunate that the 2.5 wasn't aligned with research and data. That was really what was politically decided kind of behind the scenes what the threshold was going to be, but it still does offer a starting point, I think. And then in terms of looking for the threshold that's right for your jurisdiction, you can do what I did, which is a multi-criteria and policy analysis. So by having different criteria and measures to evaluate different policy options, you're looking at the trade-offs within different models. So something that I recommended in my report is that if you're in a jurisdiction that your supply is also totally toxic and not clear-cut, then it makes sense to have a cumulative threshold, because as soon as you have a different threshold for each substance, you're asking police and people who use drugs to be able to decipher between their substances, which just logistically would be so challenging. Like people don't know what they're buying. So that would be something that I would say is consider a global threshold. And then with the no threshold model, I think just more research is needed on these kind of unintended consequences, because it could be a really freeing model that includes everybody who uses drugs. But there are risks with it that maybe make it not feasible. But yeah, I would say that trying to do an analysis where you look at different components would be really great. The other thing is you can get seizure data from your police force, which I found to be a really helpful component of my analysis. So in Canada, it's protected under privacy legislation, but you just apply for something called a Freedom of Information request. And I did that, and I received all the drug seizures that the BPD had within a 2-year time span. And I could basically analyze like what's the average amount of drugs that they're seizing, what's the most amount that they're seizing, and use that to kind of inform building these different models and evaluating these different models. So I would say that drug seizures and trying to get police data would also be a really great place to start as well. I hope that that's helpful. I'm so grateful that you gave me the time to come chat today. This is really great. So thank you.
Yeah, definitely. And thanks everyone for coming. Obviously, thanks Erica for being here, Luis for our tech support guru guy. And yeah, I think that's it then. So I will just thank everyone for joining and the recording, and I will hopefully see y'all soon.